I would love a little more information on the myocarditis concern, as rare as that is. I think in the trial so far, maybe I think it maybe didn't even show up at all in that 5 to 11 age group. But if my son were to get this extremely rare side effect, it sounds scary. Heart inflammation, hearts are a big deal, right? So what does that look like if that is something that he would get? And then what is the treatment for it? What is the long-term effects of something like that if he were to get it as a 7-year-old?
Yeah, great. And Dr. Posse, I bet you've been asked that question a lot. Do you want to take this one?
I have. I'll start and then perhaps go back to Dr. Alyssa. So Megan, that's a great question about myocarditis. And when we have these terms, I generally always want to start with a definition, right? So when we hear the word itis, that's inflammation, right, of an organ. So myocarditis is going to be inflammation of the muscle around the heart. Generally, when we see myocarditis, it is treatable. Right. Generally, we call supportive care for those that we see that in the community. Right. So they're symptomatic. The things that we might see with myocarditis is their heart rate may go up. They may have some trouble breathing, but again, we treat that supportively, and over time that will resolve. So when it comes to the concern of myocarditis, as you have stated, we have seen it in the adolescent population, so that 12 to 17-year-olds of those who have both received the COVID vaccine and then also those who've had COVID and then gotten myocarditis. And what we have found is that those who had the COVID-19 infection and then got myocarditis actually had worse symptoms. From the COVID-19, they had worse myocarditis symptoms. And so for those with who got myocarditis from the vaccine as a side effect, their symptoms were less mild, right? So not as severe, and they were able to be treated and monitored in the community or at home. Now, for this age group of 5 to 11, what the trials are showing us is that actually so far in the data, none of the children have actually had myocarditis as a side effect, which is really, really promising, which is great. And so, of course, as a parent, right, I'm sure your concern is, well, if they get COVID-19 and they get myocarditis, right, or if they get the COVID-19 vaccine, they can still get myocarditis. You're hearing that as a risk, which I understand, right? So what we think about as pediatricians is, to me, there's an if or, right? So there's always a risk. You have to think about the benefit, right? Which is, to me, and again, I think many of us share the same sentiment, is that what is the less risk, right? What is the less risk, right? Which is, how can I ensure that my child will not develop these severe symptoms from COVID-19, right, or other illnesses? There's always a risk in that. And so what we don't want to see, right, is even a healthy child who gets myocarditis from an infection can get very, very sick, where they can even be hospitalized, what we call like severe morbidity, right? So there's a balance, but we're also seeing that those who, and the percentage is low, but it's still there, who got the COVID-19 vaccine and then got myocarditis as a side effect, that they are recovering much more quickly, right? And that is a less risk. So that is the balance that we discuss and that we talk about.